Within my role, I focus more on the local health department side, and so we partnered with the Kentucky Health Departments Association, or KHDA, and we allocated some PHIG funding to them to use on different workforce development initiatives and capacity building efforts at the local level. And so they use funding on things like tuition assistance, professional development training, HR and legal support, financial support, as well as IT support at the local level. Additionally, we allocated some PHIG funds to the local health departments, again, to focus on capacity building initiatives and public health transformation activities at the local level. And a lot of health departments have been using that funding to support their community outreach events. I know one local health department, they used that funding to throw a Hula into Health community event, which was super fun. In Kentucky, we have 120 counties, and each of those counties are covered by a health department. So we have 61 local health departments. We have independent health departments, single county health departments, and district health departments. In the tuition assistance program, I believe around 90 individuals across the state have utilized tuition assistance through KHDA. I think, going back to school, it also, helps with that sustainability aspect and, preparing the next, wave of leaders to take on those roles within the health department. So I think, higher education allows them to, further expand their tool belt when they go back to school and feel better prepared to step into those, management and supervisor positions as well. And I think having, tuition assistance available to local health department staff has also helped in, the retention aspect. Tuition assistance hasn't been always available for individuals, so I think it also, just helps with that retention piece. It's important to put that focus on, public health staff, because in order to better serve our communities, we first have to, focus on ourselves and better ourselves so that we can fully, give back to our communities and support our communities. I think through the tuition assistance and honestly just like the PHIG in general and what these funds give to staff is just like a feeling of investment in them. I like the analogy of when you're on an airplane, the flight attendants always ask you to put your oxygen mask on before helping others. And I think it's the same in public health. We have to help and invest in our workforce so that we can better serve our communities.